Hello, welcome back. In this episode, we'll be talking about free healthcare schemes in Nigeria and how affordable are laboratory services in Nigeria. So, Ona, please, are there available free healthcare schemes for Nigerians?
Generally, across board, we do not have totally free healthcare, and we do not have state-funded healthcare. Patients have to pay out of pocket or be on a health insurance. And currently, the health insurance adoption level for Nigeria is also less than 10%, which is also a very poor number. So it's like out of 200 million Nigerians, we don't have up to 50 million covered by any form of health insurance. So when they get to the hospital, they have to pay from their pockets.
The other question to ask concerning that is, since it seems there is no free healthcare services or program for Nigerians, that we help to encourage people to report for any medical interventions. Can I ask if the cost of laboratory services in Nigeria is low or fair enough, or is it high? Since it is not free, is it fair enough or is it on the high side? Because if it is not free and it is expensive, then we have more problem to deal with, isn't it? But meanwhile, before that, someone wants to say something.
Thank you so much for your time, Mrs. Abimbola. You've really been so helpful with your invaluable information. The free healthcare, you made mention of insurance. And I don't know whether you're talking about a private insurance or the government insurance, because I remember that there's something they call NHIS.
Yes.
I was working in OATHC, Elisha, Wesley Gate, and I can remember a lot of the people that came usually come with that NHIS paper, and they either get free or subsidized test fee to pay.
Okay.
So is it that it's no more working again?
No,
The NHIS is no more working again in Nigeria, or the capacity is now low?
Okay, NHIS is still very much operational, and NHIS is the Nigerian Health Insurance Scheme, and they have both the public and private providers. The public is, of course, the NHIS federal, as well as the states funded health insurance agencies. Like, for instance, Ogun State has Ogun State Health Insurance Agency, which is Okshia. Some other states also have similar offerings. Currently, it is 15,000 naira per year. They have the private sector programs, they have the public sector programs. Okay. Well, although now by the Nigerian Health Insurance Act, it has been made mandatory, which is not yet fully implemented. The state health insurance is actually like similar to the federal, but I guess the aspect of awareness has been very low. And then sometimes people ask, okay, why should I pay for health insurance when I'm still struggling for food? So you find people not readily, subscribing to pay for health insurance because they feel that that is like a luxury, even though it is not. I founded a group of volunteers, and we go out for outreaches in the villages. People say, oh, even after you pay for this healthcare insurance, when you get to the hospital, will you get the service you need at the time you need it? Because one of the pillars of universal health coverage is that healthcare access has to be, delivered at the appropriate time and without putting the people who need that service into financial, imbalance or instability. So appropriate care at the appropriate time and at appropriate costs, or without, pushing people into financial bankruptcy. That is the pillar of universal health coverage. So we do not have, universal health coverage in Nigeria yet, at least for majority of the populace. On the aspect of whether NHIS is still functional, it is still very, very functional. The law that is guiding the activities has been amended. NHIS is now known as NHIA. That's Nigerian Health Insurance Authority. So they are still very much active and still providing services to Nigerians.
Yeah. So apart from the fact that we have skeletal insurance programs, now looking at the cost of accessing laboratory services,
yes,
how can we grade that? Is it
yes.
high? Is
On
it expensive?
that, I would want to answer it from two perspectives. The perspective of the laboratory owner or the laboratory practitioners is that the cost of services is low. In my facility this week, costs have been reviewed upward. And that is because currently there is quite, should I say, an increase in inflation based on increasing cost of gas or petrol, as the case may be. And that has led to increased cost of transportation, food, a lot of other things are, increasing in cost. So we had to review prices this week. However, when you look at it from the perspective of the patients, the people who have to access the services, cost of care or cost of medical laboratory testing is very high. The minimum wage in Nigeria is 30,000 naira currently. That 30,000 naira would get you a couple of tests like maybe electrolytes, urea creatinine tests. You will still be able to run hemoglobin A1C. We call something a metabolic profile in my facility, which is hemoglobin A1C, the electrolytes, urea creatinine, fasting lipid profile, and urinalysis. So you will get all of that at less than 30,000 naira. You would still get maybe your full blood counts added to it. But consider the fact that that 30,000 naira is somebody's monthly pay. Like someone is earning that 30,000 naira for the whole month. Can that person afford to pay even 15,000 just to have some tests done? Depending on the income level of the person that is assessing the test, it can either be cheap or it can be expensive. So for most Nigerians, medical laboratory testing is not cheap. But when you look at it from the perspective of the medical laboratory administrative or managerial, personnel, we are doing the best we can, but it is not cheap for most Nigerians.
Yeah, I understand what you said so well. Even though we are looking at it from the public and private perspectives, because government bill might not be the same with private bill.
There is not much difference. The differences are like maybe for specific tests, but when you look at it cumulatively, it's not really a significant difference in my opinion for most of the private and public. But you might have a couple of, high rates private labs where their own prices are way out of the league of most people. But those are like exclusive labs that serve a particular type of clientele. Like they serve the influential people of the society. Not the type of private labs I'm referring to.